Good morning. This is Dr. Beck here at LifePoint Medical. It is June the 8th, 2021. And again, I'm carrying great news this morning. No more new cases of COVID-19 in our community. It is flatlined, and I hope it stays that way. And I'm praying that it stays that way. And I think we all should be celebrating, really. Getting this thing out of our way is a big deal, and it's been a traumatic experience for most people, emotionally and everything else, and some people physically, but maybe it's the part of the area and it won't come back. So I'm hopeful on that deal. I'm still kind of looking out for it, because I do have patients, and I'm always concerned about whether they're ill with this disease or not, especially because of allergies, and it kind of looks the same, but we're doing good right now, and we haven't seen any, and it doesn't look like any's been rolled in. So I want to talk to you just a little clinical pearl this morning, and I've been over this before, but it has to do with regenerative medicine and the platelet-rich plasma that I do. You know, the platelet-rich plasma is the thing where I draw your blood out, spin it down, and I use a certain segment of your blood, and I use that as a healing mechanism into joints. And the main one is the knee. Okay, so there's a few things about knees that I want to talk to you about. So first of all, it's very common, if you're old enough, you're going to have some knee pain. Additionally, if you are overweight or deconditioned, you are likely to have knee pain. And most of the knee pain or at least the early knee pain, or severe osteoarthritis of the knee, which is age-related knee pain, is due to an imbalance of the forces around the knee and the intensity of the forces around the knee. In other words, if you're the more weight you put on, the more pounding on that knee you get every day. And if you're severely overweight, your knees take a licking every time you take a step. So it's a vulnerable thing. So if you find yourself with knee pain, the first thing I want you to try to do is try to balance out the forces around your knee. And how do you do that? You start working your anterior thigh muscles, the muscles in front of your legs. Start working those out so they burn, and you keep trying to strengthen those. You can do leg lifts, or you can just practice getting up out of a chair without using your hands. And you do that like 10 times in the morning, 10 times at night. Whatever you got to do to try to strengthen those muscles on the front side of your legs, because that's usually what happens. If you balance those out a little bit, provided you're not advanced disease or you are not tremendously overweight, that will help with some of the pain. But if you live long enough and you travel enough on your knees, you're going to get osteoarthritis. So one of the treatments for that is the PRP, and it seems to work pretty good for your knees. And most of us, if we're lucky, we're going to live long enough to wear our knees out. Okay, but this is a way to mediate it, and I recommend this if you are just starting to have knee pain, or you've had it for a while and you're trying to delay surgery, or you don't want surgery, or you can't have surgery. This would be a good treatment for that, and that's the platelet-rich plasma. And if, sometimes we give cortisone shots in the knee, and I do those quite often, and it works a lot of the time. If it does work, if you get a cortisone injection and it does work, that's an indication that most likely the PRP will work. So anyway, there's a short, brief explanation of knee pain. Lots of people get knee replacements, and I understand that sometimes those are necessary, and I talk to patients all the time about should I get knee surgery or not. And interestingly, if you're really young, I recommend you do it quick if you're going to have it. And if you're really old, I try not to do it because of all the other things that come along with that, like using the anesthesia and stuff, because everybody knows that after you get older, the anesthesia really kind of has a lasting effect on you. And I don't like the dangers posed by getting general anesthesia as an older individual. It can be it can really set people back and things like that, and all the other complications go along with it. So anyway, we got PRP. It's not covered by insurance. I do charge $500 per draw, and I can actually use one draw in more than one joint. So if you're interested in that, just let us know, and we'll get you scheduled and come in and talk to me about it. That's a legitimate office visit. to come in and talk to me about the PRP. All right, last but not least, Place of Hope. We're selling bricks. We got forms up here, $100 brick, $200 brick. You can put or commemorate your life or a family member's life at Place of Hope. It'll be used around the grounds in there, and I'm buying a bunch of bricks just because I want to commemorate several people in my life that really were key to my life and who I am today, and they weathered the storm for me so that I could be here with you today, and I appreciate that. All right, this is Dr. Beck. I'm at LifePoint, and I'm by myself today, but I still will see you if you need to be seen, okay? And I've worked many years by myself, so it's not a big deal, but it's been a while since I worked exactly by myself. So you have a good day. Call us if you need us.